The first thing we're going to do is, this is about the 2017 regulatory changes, and that's that 902 KAR 2060. And I just want to say that even though I'm presenting this today, I have to give credit to one of the other immunization nurses, Deborah Bolton Plucknett. She's the one that did these slides and presented, I think if any of y'all were in Bowling Green in December of 2017. To school nurses. So anyway, the objectives is, as you can see, review the new Commonwealth of Kentucky Certificate of Immunization status, and we're going to review the new parents or guardians declination on religious grounds too. And we're going to review the regulation requirements effective for the 2018-2019 school year. And also I've thrown in a couple other things in here too. And with describing the new immunization requirements, they're giving out 2 handouts right now that's got KIC, that's the Kentucky Immunization Coalition, and LINK, which is our coalition in Northern Kentucky, did these handouts. And that'll help with letting you know the ages. It's a real quick look at where you can see the ages and you can see what do they need by now. So if you look at, 3 years old, you're going to see that they need the 2 Hep A's, that kind of thing. And then also with those new vaccine regulations, we're going to talk about the Hep A that they need 2 of and the second quadrivalent meningococcal vaccine. Let's see. Then also we're going to some links to access the Commonwealth, the certificate, and also the religious declination. And what websites those are. And we're going to find those on the immunization registry and the Kentucky Immunization Program link, and then the KDE, the Kentucky Department of Education websites, all those. And then also, there should be a handout that y'all receive that is, oh my gosh, invaluable to us. It's got a lot of resources that help with nurses that are given these immunizations. And it's got like the CCSG, and then it's got the CDC recommended schedule, and that's really good to see with the footnotes. And then also the pink book. Woo-wee, do we use that pink book? Everybody knows what that is. And then ask the experts. I don't know if any of y'all have gone to immunize.org, but that is an excellent site to ask the experts. There's all kinds of scenarios that CDC experts answer. If you give something too early, or it's got everything you can think of. The first thing is that on that next slide is the 902 KAR. Basically, that's just immunization schedules for attending child daycare centers, certified family child care homes, and other licensed facilities where care for children, preschool programs, public and private primary and secondary schools. And that's the link where you can find it. And it's, boy, is it in lawyer language. It's a long one, but it's very detailed, so you can get that there. Also, with the revisions that are effective for this next coming school year is that if they're 19 months and older, they need to have the 2 doses of Hep A vaccine. And if they're 16 years and older, they need to have received at least 2 of the quadrivalent. And that covers the serogroups A, C, W, and Y. And with that being said, make sure they're 16 years old. We've had a few that were given before 16. So make sure they are 16 or a few days older. Also, let's see what we've got. Providers should catch up, needless to say, children 2 years and older to assure Hep A immunity. And since that came out in 2006, there was a lot of the younger ones that have had their Hep A, but needless to say, some of those 7th graders coming in, those 11 and 12-year-olds, make sure you look at those closely, and of course when the 16-year-olds. But everybody should be coming in, and we'll talk about that a little bit later. It also goes on to say that they need their 2 doses. It says children will need to complete Hep A immunizations prior to the start of 2018-2019 school year to attend school. And those 2 doses are going to be 6 months apart. Well, guess what? Some got started in March. And so needless to say, they're not going to get those 2 doses in before school starts. So as long as they have had their first dose. So that's real important. So that's a little bit different than what that's saying. So they have to have their first dose in, and that immunization record will say that they're to return in 6 months to get that one. And so needless to say, they'll be in the tickler that if they don't, then rot-row. So let's see. The second, let's see, that was added, the second dose of the Menactra or Menvio, that Men-ACWY. It was so easy saying MCV4, wasn't it? So much easier. So, and then there are 2 doses that's been added to the certificate. And then the electronic produced certificate requires data elements for that regulation as well. And that'll be discussed a little bit later. Let's see. The new process for obtaining a religious exemption. Okay, that one required for the school immunization and requires a written sworn statement, and that'll need to be notarized. So that is something different. That they can get those on the 2. They can either get it from the KDE website, they can get it from the KIP website, and go fill it themselves. So that next slide, it goes on to say parents are now allowed to obtain it from the form online. And then the parent can actually check the immunizations they object to on religious grounds and sign the form in front of a notary public. Has to be done. And then it can be submitted for enrollment into school, child care facility or into school. Now, when the child has no vaccination history, the parent can and is declining all vaccines, then they can do it that way. But, and they can even print out the form. You can refer the parent to that form, or you can even provide them a copy in the office if they come into the health department or wherever. You can tell them where to get it, or you can actually print it, have it printed and give to them. The only thing is that make sure you document it, that whether you gave it to them, or you recommended them to print it online. So that's just kind of good to document that. And then, of course, any notary public in Kentucky can notarize the form. And that's the only form needed for school if the child has no shot history whatsoever. Needless to say, that changes. That changes if they do have some shots. Let's see. Okay, this next one. The Kentucky immunization regulation does not permit philosophical exemptions to immunizations. Kentucky only has medical or religious to immunizations. And we get those calls all the time. Parents calling, what, I've got to get this, I've got to get that. We don't believe, we don't like it for whatever reason, but it's not religious. And so basically we say, there's several ways your child can get into school. 1, they have the immunizations, they get the official certificate. 2, they, based on religious grounds, that you check the immunizations that are a religious exemption. And then 3 is a medical exemption. The doctor says for whatever reason, medically, that your child cannot get the, so it's like, and it's like, there are 3 ways that you can get your child into school. So, that there is not a philosophical. Needless to say, we don't know if they may be taking a religious exemption, but not for us to say. Now this also, I was kind of hoping you'd see it in big. I'm sure y'all have already seen these, but this is what the next slide is what the guardian declination, the parent or the guardian's declination on religious grounds, what that looks like. And that was effective June 21st, and it can be found on the KIP or the KDE web pages. And the parent or guardian must sign the form before a notary. You're going to hear some of these, it's a repeats. So, but it's got to be signed. And then providers can continue to use their certificates they've used in the past as long as the printed certificate includes the new required immunizations and meets the minimum requirements for an electronically produced certificates for those EMRs. So it's a lot of ifs. You can, but it's got to have this, this, and this. So a certificate printed from a provider or health system EMR does not need to match the size or orientation or the format that's printed from the registry, but it has to have a signature. It does require a signature. The certificate can be signed electronically, but it's got to be signed. The only certificate, the only one that does not require a signature is the one printed from the immunization registry. That is the only one. The others all will need a signature. Let's see, acceptable certificates for school entry is with the hard copies is either it's been printed from the KIP or the KDE web pages, which we'll have that link for you, or it's printed from the Kentucky Immunization Registry, or it's the EMR from the provider's electronic medical record. And those that are printed from the KIP or KDE web pages is the only acceptable handwritten version as well. And it's got a watermark at the top. It must be printed, the name and signed by a physician, an APRN, a physician assistant, a pharmacist, a local health department administrator, the registered nurse, or an LPN now has been added. Let's see. And those are the required certificate documentation. That's everything, you know, we know. It's going to be the name of the child, the birth date of the child, the name of the parent or guardian, and their address. And it'll have the types of the vaccines administered, the date each dose was given, and it's a certification that the child is current for immunizations with a specific date, including the statement that the certificate shall not be valid after a certain date. Okay, that's basically repeated. Okay, and then the KYR, we've already talked about that. It'll have the seal at the top. And the signature line has been replaced with a citation of the regulation. That's why it doesn't need a signature. Okay. If they have an out-of-state and they receive one vaccine here, needless to say, it needs to be on ours. It needs to be on ours. On our certificate. And then also, this just talks about the regulation incorporating the ACIP recommendation catch-up schedule for children who are behind on immunizations. And then also, because of Section 4.7, it permits a signed certificate or a certificate printed from the registry to be faxed from a medical office to a medical office, healthcare facility, childcare facility, school, or state or local health department. And then this is what the certificate's printed from the KYR. And that's what it looks like, where you don't need a signature. And then as you can see, it lists all the required and recommended immunizations, where in the past, you know, those records only had the required ones on there. So this is kind of nice, because with it having the recommended on there as well, because guess what? Now the parent has something they can take and keep on their file at home as well. They can keep a copy and have that, and it's got everything. Because that is what we get a lot of calls on. Where's our shot records? What have we had? We're going to school. We're going to nursing school. We're going to, you know, and so it gets real complicated. So this will make it nice on forward.
So if I wanted to look up my immunization records on the KIP website as an individual, not associated anywhere with a medical office, can I do that?
It's not on the KIP website. It's just on the immunization registry. But no, that's not accessible to the public. Yeah.
But yours wouldn't be in there anyway unless your provider, your medical home, had entered them in, because they're historical.
Yeah. And
so very doubtful, unfortunately.
Yeah, I know. Thank you. And with the Commonwealth certificate too, that was effective June 21st. It can be found on those pages, and we'll give that too, just a repeat. And it goes on to say too about, you know, if it's effective, if it's provisional, if it's religious objection. So it'll have on there. which one of those was marked. Provisional, I'm sorry, provisional, or it's good. Let's see. Okay, this is what we see a lot too, is only the valid doses are going to be printed on that immunization registry version. Invalid doses will not appear and do not count towards the updated doses. And we hear that a lot, that they're given early, they're given too young, they didn't meet that minimum interval. Boy, that is so important. Oh my goodness, I don't know how many times we've had to say, they got to get it again. And you hate it, but you know, that's going by the guidelines. So make sure when they come in, you're looking, okay, how old are they? Have they had that birthday? Has there been 6 months in between? All those things. Let's see, that's a repeat as well.
I know in the pig book,
Uh-huh.
I know it says something about a 4 day.
There is a 4-day grace. 4-day. But boy, don't depend on that, because that's what I think that's what happens sometimes. And guess what? We've had them like come back and they're like 8 days too early. So just really look at those dates when you're scheduling and bringing them back in for that next time. Really look close. I think that's just a repeat too. It's just talking about how you can go on the KYR and find out how to print those too, and it gives some instructions on there. Let's see. Like we talked about, all shots listed on the new certificate is not required for school entry, but it goes by the ACIP recommendations. And you're going to see those that have been added: influenza, rotavirus, HPV, MenB, pneumococcal. They're not required for school entry, but at least they'll have that record when they're given. And I can't help but, even though we're talking about regs, I can't help but talk about when you see that HPV pop up, is when they come in for those 7th grade shots. They're 11 to 12 years old. Let's try to get those HPV, get that first one in, because if they go ahead and start early like that, it works better for one, but two, they're only going to need 2 doses. So that's, you know, it's a little ouchy. That one is a little ouchy, but they'll kind of let you know it's a little ouchy. But at least you get that first one in. And you know, Mom, it's not all about sex, you know, because they want to, oh, my child's not having, they can't even comprehend, which I can't either, because I got 11-year-old twins, but I can comprehend that one day, it's hard, but one day they will meet someone. Time from now. But, you know, and I want them to be protected from genital warts, from cancer, cervical cancer. There's a lot more things now. So anyhow, sorry, got to get on that soapbox. And then also MenB, I got to go there too. It's something that we forget about, that MenB. Darn it. It's all about the ACWY, which those are the required ones. Got to make sure I say that, because we heard one clinic out there, not a health department, but another one of the VCF clinics, they were given MenB for their required. Which we're glad they were getting some MenB, but yeah. So anyway, we got to make sure they're getting that Menactra or Menvio at 11 to 12, and they're getting that Menactra or Menvio when they come in for their 16. But when they come in for their 16 to get that, let's make sure we have, even though I know it's kind of soft, the ACIP recommendations, it says clinical discretion, but we need to be talking about it every time. When they come in for that 16 Menactra or Menvio, make sure we talk about MenB as well, because guess what? That's what's showing up on our college campuses. So, yeah, so let's make sure we have that discussion. Sorry, you all. I just gave a talk about meningococcal disease last week, so to the nurses and EPIs. So anyway, got to cover that too. That's already been done about the 2017-2018 school year. Sorry, I didn't take that out. And due to delaying of the new immunization requirements for this school year, they're going to be reviewing grades 7, 11, and 12. And the reason being is make sure those 12th graders got their second meninge, their Menactra or Menvio. And so that's only, the 12th grade is only for this year. We don't want to forget about the homeschool children. If they participate in any kind of sports or come and attend one class or whatever, they must have the same thing. Even though they're homeschool, if they are playing a sport or attending one of the class or whatever, they need to either have the immunization certificate or the religious declination. And this here talks about the updated video on the immunization registry. It talks about how you can go on. It's got a YouTube link that you can go on and find out how to access that. And then we've got like I promised you, we've got the links to the Kentucky Immunization Program and to the Kentucky Department of Education. It gets a little exciting now with our CHFS links. They've updated it, but with that, it's going to be a lot better, but it's just, it's finding things. They're in a little bit different places. The next place is if you do have any questions, please do not hesitate. As you can see, that contact information. There's Deborah Bolton Plucknett, there's Troy Cunningham, there's myself, Julie Miracle, which she's the nurse that actually went to these regs meetings and all that kind of stuff last year, and then a Kristy. And then it's got our number, the 502-564-4478, and do not hesitate to call us with any questions. And then also, it's got the help desk too. We've got the help desk number on there, 502-564-0038. And I better leave Kristy some time. I got motor mouth. Okay, thank you all very much for what you do out there and getting our kids vaccine preventable disease taken.
Thank you for your patience. I'm Kristy, royalty, a nurse with the immunization program as well. I work mainly with childhood vaccines and vaccine preventable diseases. So that's why we're going to kind of skip to the diseases that these immunizations help prevent. So let's see if I can get this to work. We'll talk about measles and mumps. If we have time, we'll talk about pertussis a little bit. That's probably something everybody has heard about, whooping cough. If you haven't, where's that big rock you're hiding under? Because some days I want to join you. All right, today we'll talk about the current epidemiology of measles and mumps, what symptoms we see, how we spread it, how long can we spread it, and what do we need to help healthcare providers do when they call you or you get that EPID 200 that says measles or mumps, and hopefully it's not measles, because if we get measles cases, it's going to be all of us working together to stop it. And then we'll talk about how you do investigations, who's immune and who's not immune. So who do we need to get immunized? Who do we need to test for immunity? Who do we need to test for disease? And then how do we prevent it, which that's our immunization. So we'll go over that again. So measles. So you look at this little guy, and the signs and symptoms sound a lot like a cold or an early just upper respiratory virus. All right, just go like this if I need to speak up more. We've got fever, cough, runny nose, red watery eyes, Koplik spots, which are in the back of the mouth. When you open up, you can see these white splotches in the mouth, and the rash. The rash, it happens last. It happens in the last few days after these other signs and symptoms. First you think, oh, I've got a cold or I've got an upper respiratory infection. But measles, that's a really, really sick child or adult, if it's an adult that gets it. But you have the 3 C's. You've got cough, coryza, which is runny nose, and conjunctivitis. So the eyes are red and watery. Looks different than pink eye. It's usually not gunky, but it's going to be red and watery, kind of like allergy eyes too. And then the rash. The rash is going to start at the scalp at the head. It's going to move down and out the body, and it's going to disappear in the same way. Infectious. So measles is infectious before that rash starts. So it's infectious when it looks like a cold or an upper respiratory infection, but sick in a sickly child with a fever. So 4 days before that rash to 4 days after the rash starts. Incubation period usually 8 to 12 days, so we might start to see secondary cases in about 2 weeks after exposure. So healthcare providers. So if you all get a call from a local provider, or if you have a child come into your clinic for some reason and they've got a rash, unknown, we don't know what's going on, or if you get a call from that provider, you want to say, let's bring this child in through the back door and let them exit through that back door. Try not to keep them in the waiting room, because measles virus can stay in one area for up to 2 hours after that person leaves. So anybody exposed in that area is going to have to be followed up with and made sure that they don't develop symptoms in a couple weeks. We want you to report it to us at the state, and those usually come to me. If I'm not in the office, then it's someone else. But this is, after hours is 1889 report. During working hours, my number is at the end of this presentation that you guys should have. We want a specimen. We want a throat or nasopharyngeal swab to come to our state lab. If your patients have insurance, a lot of times your provider may want them to send it to their local lab, and that's fine. But if we can get it sent up to us, they will send it to the public health laboratories in New York, and they will also do the mumps testing that I'll talk about in just a few minutes. So investigation of a suspect case. So we want to see that medical record of this, usually children, but it could be adults. So we want to see that medical record. Have they had the vaccine? If they had, it's a very good vaccine, especially against measles virus. So it would be unlikely that it's measles. Hopefully it's another type of rash illness that doesn't spread as easily. But we'll see, we have to get a record of who all they've been around, and especially the 4 days before that rash started. So if they can remember, and that's a big task for those parents to remember, especially if they're in school or they're in daycare, they've been shopping, they've been with a lot of family members. That's a lot of people that we gotta try to get in contact with. We want to see those people that are contacts. Are they immune? Have they had 2 doses of MMR? Depending on their age, have they had the disease itself? And we can also now use the registry. For those that have had the registry or inputting vaccines in the registry or have put historical data in the registry, that's a quick, easy, you pull up the child or the adult and see if they've had those 2 MMRs. So presumptive evidence of immunity. There's a couple ways to look. Do we have that written documentation of 2 MMRs or just 1, if depending on the age of the child? Laboratory evidence of immunity. So do we have an IgG that tells us that the titers are high enough that they've been exposed, they've had the disease, or they've been immunized in the past? Birth before 1957 or laboratory confirmation of disease. So if your contacts don't meet any of these, then they're susceptible. So they either need to be immunized or given Ig immune globulin, which we'll talk about in just a second. So measles post-exposure prophylaxis. So it's the vaccine. You can give the MMR vaccine within 3 days. 3 days. So we've got a short time period here too that we got to get in contact with these people, get their history, and then get them protected if we need to. So MMR vaccine can be given within 72 hours for those that are eligible. If they can't remember if they've been vaccinated, there's no history, or if they've only had 1, let's get another dose in them. And then immune globulin is either given IM or IV, can be given up to 6 days. So we've got a little bit longer window. It's still not very long time to get them protected. And that's for infants less than 12 months because they're not protected at all, for pregnant women and for immunocompromised persons. So healthcare settings. Well, of course, healthcare workers, we're susceptible, the most susceptible to those kiddos that come in, they're coughing in your face, hopefully not, they're snotty, and then you might notice the rash, you might not. They may not even be at that point where they're developing that rash yet, but you've probably been exposed, possibly. So all persons that work in healthcare facilities are first line at getting exposed. So what we'd like to tell healthcare personnel, that always, anytime you work somewhere, hopefully they're getting your vaccine history, or if not, you're giving it to them. We hope that they really get your vaccine history. So if you're not protected against one of these preventable diseases, that you can soon be. But for healthcare workers, the same. It's those 2 written doses, depending on the age. Laboratory evidence, laboratory confirmation of disease, but we do not use the birth before 1957 for healthcare workers. We want there to be evidence of 2, and this is strictly for your safety and for your protection. So we want there to be 2 doses on file that you can give documentation of disease. If there's not that, then we really recommend getting those 2 doses separated by 28 days. It's usually a cheaper way instead of doing titers. I know a lot of healthcare providers, where you work, they'll do the titers. It just depends. So the majority of people that get measles were unvaccinated. So thank goodness we don't see much in the U.S. And in Kentucky, knock on wood, we've not seen any in several years. So last year there was a big outbreak in Minnesota in the Somali community. Well, they traveled to Somalia and then back and forth to those communities here in the U.S. They're unvaccinated, or at the least under-vaccinated. So that's where that spread became. And then usually it is our international travelers. We see there's outbreaks in Europe right now, in Asia, the Pacific, and Africa. So those that come over on an airplane and they have measles, guess what? They've exposed everybody possibly, because that virus is in the air for 2 hours. So a lot of times, and you all may hear from me or somebody in our office, we'll get from CDC, we'll get flight information once they know a confirmation or confirmed case of measles, and they have to go through basically the line list of everybody on that flight, and then that goes out to all of us. So I may have, a couple in, Jefferson County or Fayette or Scott County that I need you all to call and follow up with to see, do they have any symptoms of measles, or have, at least please tell me that they've been immunized. So that it's more work when there's an exposure, possible exposure. So if you get calls, or if you know of people going to be traveling internationally and they call you and ask you about their immunizations. Well, when it comes to MMR, if you've got a baby that doesn't yet have that first one, we would recommend a dose if they're at least 6 months of age through 11 months of age. And then children 12 months and older, they can go ahead and get those two, but they have to be separated by 28 days. And then your teenagers and adults who have no history or don't have that two-dose history of those. Now, those infants that you're going to immunize early, that 6 to 11 month, that's not going to count as their first dose. So they'll still need that dose. They'll need that 12 to 15 month, and then that 4 to 6 as well. All right, we'll kind of jump to mumps. This is the same vaccine, measles, mumps. We won't talk about rubella today. But mumps is the weaker link in that vaccine. Measles, part of that antigen in that vaccine is really strong. The mumps is a weaker link there. That's why we're starting to see some more cases, especially in our high-risk populations, like our college kids that swap spit, about like our daycare kiddos do. So that's where we're seeing a lot of it. Last year we had a couple, and I know the year before, in 2016, they had quite a big outbreak on campus here in Lexington, over 90 cases of mumps in our college student population. This last year we had a couple just smaller outbreaks at UK and then at Murray State, so in the western. So it's not specific to a certain part of the state, but and this year we're not seeing that right now, but it is around. It's all around the states surrounding us too. So in mumps, this kiddo's not feeling good. Fever, headache, aches, tiredness, loss of appetite, and then you see this ginormous swelling on the side, peritidis. This is different than just your lymph node swelling. So it's actually in that salivary gland there. It's infectious, of course, a couple days before this is seen. So they're spreading that around before we even know that this is mumps, until after 5 days. So if you get that call, especially if I get a call, I'm like, tell them to self-isolate for 5 days. Stay inside, stay out of school, stay out of daycare. Incubation period, usually a couple weeks up until 25 days of exposure. Lab testing. What I see the most of is IgMs, and I don't want to, because it doesn't tell us the true picture of what's going on here. And we can get a lot of false positive IgMs as well. And I'll tell you some of those other things that cause that. But what we really want is a buccal swab, which is just a swab like you would do a flu swab or a pertussis swab. But you massage that salivary gland for about 30 seconds, and then you put that swab there, and then just put it in its container, and we can, like with the measles specimen, we'd really like it to come to our state lab, and then they'll ship it off to New York to that public health lab as well. But if there's a local lab and your provider wants to send it there, that's perfectly well. We just want to make sure that you all and myself get those results from those tests. So the mumps IgM antibody, like I said, we get a lot of false positives. It could be that they've been immunized recently, or even 6 months prior, we'll see a false positive there. Flu, and peritidis is seen in flu quite a bit too. So we can get false positives if it's really flu, if it's strep, if it's mono, even HIV in susceptible people or people at risk for HIV, they can get that peritidis. So whenever I get a call or we're talking with providers or local health departments about what we want recommendations for these other testing. Let's rule all this other out before we actually say that it's mumps. So, and this is just what I talked about, this PCR testing. Just make sure that, give the guidance to massage that salivary gland for 30 seconds before they actually take the specimen. And usually 3 to 8 days after that peritidis onset, we'll still get a good specimen, still get an accurate result. even up to 11 days, if you've got somebody that's unvaccinated, we might still get a good result there. So our immunity for healthcare workers is exactly the same as for measles. That written documentation of 2 doses, laboratory evidence of immunity or evidence of disease, or birth before 1957, which we do not recommend. Prevention of measles and mumps. Well, that's 2 doses of MMR at 12 to 15 months, and then again at 4 to 6, or in your adolescents and adults that need catching up, at least 28 days in between those 2 doses. Especially in our people at highest risk, our students at post-high school educational institution, international travelers, healthcare professionals, pregnant women, people who are with immunocompromised persons, or people living with HIV. We do have a new ACIP recommendation for a 3rd dose of MMR in our mumps population, and that's something that we want to discuss with you all. If you know a provider that's going to suggest that 3rd dose, let's talk about it. Usually it's going to be in your outbreak settings, which outbreaks are more than 2 cases in a certain area in a certain amount of time. But we want to, more than likely we will, like in those outbreaks on college campuses, they're asking for those students that have had 2 MMRs in the past to go ahead and get that 3rd dose. And then there are just resources, and I think you all got this PowerPoint. But there are resources like Debby, that pink book we use every day. I use the red book. If you all have not seen it, I've got one back there I can show you. And CDC surveillance manual for vaccine preventable diseases. Priceless to me. They're out all the time, so they make my office look really messy. All right, this just has my contact information on it. It has the lab. So if you can't get me, they are obviously the experts on how to do that testing, how to package it. What if it's Friday afternoon? What do I do? They'll tell you exactly what you need to do to keep that specimen in good condition until we can get it off to the lab. And then our after hours number, if you, for some reason, if it's after 4:30 or after 5 and you're getting a call or you're on call for your facility, then you want to call this number and you can get guidance on what to do next. I don't know what time it is. Is it about time? Yeah, okay. Are there any questions? I got any questions?